we have attendees coming in. Welcome. Welcome, come on in. We have attendees populating, so we'll give folks a few minutes to get into the room and get settled, and then we will get started. I am going to go ahead and share my screen so I'm ready to go. And I will say for our team, I am sharing. I cannot see your faces right now, so I'm going to give it a few minutes to get folks in. But if you need to say anything to me, I do have the chat up, but I cannot see the gallery at the moment. So. All right, we will give it another 30 seconds or so, and then we will jump right in. Welcome. Thank you all for joining us today. Okay. Okay, let's go ahead and get started. Good afternoon, everyone, and welcome to today's Council on Black Health webinar entitled Reclaiming Our Power and Autonomy, the Citizen Community Scientist Approach to Community-Led Research and Engagement. Today's presentation is offered as part of the Council's Solutions to Diabetes in Black Americans Core. Now, this core is part of the NIH-funded Center for Diabetes Translation Research at the Washington University in St. Louis. The Solutions to Diabetes in Black Americans Core provides methodological and content expertise to advance the field of diabetes research in Black Americans. We appreciate you joining us this afternoon. My name is Melissa Witt-Glover, and I am the Executive Director for the Council on Black Health, and I'll be your moderator today. The Council on Black Health is a national research and action network. Our mission is to develop and promote solutions that achieve healthy Black communities, and we work to achieve our mission by leveraging the credibility and perspectives of Black American researchers, other collaborators, and research partners to facilitate relevant, community-engaged, and actionable solutions that positively impact Black communities. The work of the Council is driven by our understanding of the impact that systemic and structural racism has on the policies, systems, and environments that impact people's lives, which directly and indirectly then impacts health outcomes and quality of life. Our approach to realizing healthy Black communities is informed by an understanding that root causes have to be addressed because those root causes are the drivers of the structural and social environments that impact individual behaviors and health outcomes. The Council does our work through three areas: research, policy, and practice. And we want those three areas to really drive each other. So our research should be used to inform policy and should be used to inform practice. Practice means things that happen in community settings, and we want to learn from and collaborate with people in communities, and what's happening within those settings should be used to drive the research that we do and our policy work. And finally, policies that impact health in Black communities need to be studied and researched, and those that work should be moved into practice. And working together, all of those things should guide us toward optimal health in Black communities. Now, to set the stage for our work in today's conversation, I invite you to watch this brief video that describes how the Council is reimagining Black health.
Council on Black Health is aligning partners around a new vision for health equity, where all Black people live safe, healthy, and happy lives, and those who provide care for us and set policies that affect our lives recognize our full humanity. To achieve this vision, we must first understand our history, honor and respect our contributions, moving through a process of accountability, reconciliation, and healing. Expand our focus beyond starting programs and towards system-based change, recognizing that people aren't the ones that need to be fixed, but systems. Create an inclusive process of building power, inviting everyone to own and drive an agenda for health equity. We all have something to offer. When this groundwork has been laid, we'll be able to get to work, building public will and systems that start to realize healthy Black communities. We will recognize our power and will value knowledge, training, and lived experience as necessary to change practices and policies that impact Black people's health. We will implement policies and practices to accomplish equity in resourcing and interventions. With funding to support it, we will identify new or improve existing systems and solutions that resolve disparities and pave the way for a healthier future. Then, we will start to see and feel the changes in our communities. We'll have healthcare that's community-based, holistic, and integrated with social support models, recognizing that health is not just the absence of disease, but mental, spiritual, financial, physical, educational, and familial well-being. We'll see bridges form between providers and sectors so everyone works together to ensure we all have equitable access to healthy food, safe and secure spaces to live, learn, work, pray, and play. Eventually, when we seek out supportive care and services, we'll feel our values and culture are reflected around us, and our lived experience and humanity will be honored in every aspect of our interaction. We'll move past existing power dynamics and towards a collaborative approach to receiving care and services that help us feel healthier. Providers will take a strength-based approach to providing care, looking at the whole person and their environment and needs, prescribing more than just medications, but other things that make people healthy. It will take all of us doing our part to realize this vision. Together, we are redefining, reimagining, and realigning our dreams because we know that all Black people will be healthy, safe, and free.
So in 2021, the council released the Black Health Bill of Rights, which we believe is the nation's first document that is a Black Health Bill of Rights for the Black community. I want to recognize Dr. Shariki Kumanyika for her leadership. Shariki is the founder of the Council on Black Health. And I also want to recognize Tambra Stevenson, who's the founder and CEO of Women Advancing Nutrition, Dietetics, and Agriculture, as well as the attendees at the 2019 Council on Black Health convening, all for their input to create this document. We don't have time today to examine the Black Health Bill of Rights in detail, but I do just want to note for people who are interested, you can access the full Black Health Bill of Rights on our website, councilbh.org, to read more about it. And just want to let you all know that the Black Health Bill of Rights is the foundational document that serves as the frame of reference to guide the work of the council. The Black Health Bill of Rights includes 7 articles that we see as the values and principles that are a critical framework that are necessary for thriving and for living a full life. And so as we think about the Black Health Bill of Rights driving what we do, today's conversation will examine the citizen or community scientist approach as a model for improving research that is community-centered. This model is one that we believe can help communities and researchers work collaboratively to better identify sustainable solutions to address and improve health. And this conversation is specifically linked to Article 5 within the Black Health Bill of Rights, which is the right for Black people to transform our health by reclaiming our power and autonomy. And in this conversation, thinking about reclaiming our power and autonomy, thinking about how we as people who are within communities and citizen scientists can be an integral part of identifying solutions to improve health in Black communities. Now, we're going to approach the conversation today really as a conversation. And so we have a panel that I'll introduce momentarily. But during this presentation, we ask that you, as folks who are attending, post questions using the Q&A button or in the chat. You should be able to access that. But post questions because we want to hear from you. I'll watch the Q&A. I'll be watching the chat if that is enabled. I'm not sure if it is, but I'll be watching the Q&A and we'll work your questions into the conversation as best we can. You can also feel free to use the any of the chat features to shout out, to give kudos, to agree or disagree, and really to interact with us so that we can make sure that you're hearing us and we're hearing you. Today's presentation will be recorded and it will be archived for future viewing, and then we'll publish the webinar online and share the link as an email. So I'm going to stop sharing now and ask Haley, if you can highlight our panelists just so we can make sure we see them. I am excited to welcome our panel for today. We have with us Dr. Kareem Watson, Mr. Marcus Murray, and Mr. Curtis Eskridge. I'm not going to read their full bios because I want to get into the conversation, but I do want you to know how impressive this panel is. So I'm going to tell you a little bit. So Dr. Kareem Watson is the Chief Engagement Officer for the NIH All of Us Research Program. And if you don't know what that is, we're going to get into what that is a little bit later. Dr. Watson comes to the NIH after 16 years in academia and in community health. And he previously served as the Associate Executive Director of a group of federally qualified health centers in the Illinois area. And when he was in that role, he developed a community engaged and implementation science research program. He was also previously faculty at the University of Illinois School of Public Health in the Division of Community Health Sciences. And through his research with cancer prevention and control and implementation of evidence-based tobacco cessation in the FQHCs, he's been working on improving health in Black men. Important to this conversation, Dr. Watson received funding from the National Cancer Institute to develop a citizen science program that engaged African-American men in prostate and lung cancer screening. So Dr. Watson is recognized as a national leader in community engagement. So welcome, Dr. Watson. We also have Mr. Marcus Murray, who is the Executive Director of Project Brotherhood, a Black men's health clinic, which he co-founded in Chicago, Illinois, over 2 decades ago. Project Brotherhood is a nonprofit community health organization that's focused on outreach and prevention education to meet the needs and improve the health of African-American men nationwide. Project Brotherhood is nationally known for pioneering the impact of providing free weekly health clinics to treat chronic conditions and to popularize the use of social support groups for men through rap sessions and barbershop education to promote health among Black men. Mr. Murray has been a community advocate for men's health for over 20 years. He's presented at over 100 national public health convenings, talking about the health of Black men before national governments, state departments, local audiences, public health conferences. He has received a number of awards. He's been invited to speak at the White House to address Black men's health. He is a national expert in terms of health in Black men, and we are excited to welcome him today. So welcome, Mr. Murray. And then we have Mr. Curtis Eskridge. Mr. Eskridge is a citizen scientist. He is the owner and a barber at Cut It Out Kurt in Chicago. He has been bringing men's health and cancer screening awareness to people on the south side of Chicago for over a decade. His work in partnership with the University of Illinois Cancer Center and Project Brotherhood includes providing education on and promoting cancer awareness and screenings for vulnerable populations. And his barbershop, Cut It Out Kurt, has also served as a drop-off location for patrons to submit colorectal cancer screening tests. So this is an amazing panel. I am so excited to have them here today. We're gonna talk about citizen science. We're gonna talk about how this works. We encourage those of you particularly who are researchers trying to figure out how to do this, get your questions ready because they are here to answer them and to help you out. So let's jump into the conversation. Welcome, guys. And I'm gonna start the very first conversation to make sure we are all on the same page and any of you can answer it. What exactly is citizen science? Don't be shy. I know y'all talk.
I'll kick us off, and I always, Marcus told me to do it. So if you're listening to this and you're watching, I'm encouraging my academic partners not just to listen with your ears, but also to, if you're watching this, because you'll see that it was Marcus from Project Brotherhood that said, "Kareem, kick us off." And as academics, it's we often have to say that we sometimes want to be the first to speak, but sometimes we got to also be told that role that we play. And so I want to acknowledge that. But citizen scientist concept, you often see that concept introduced in environmental health. It really rose out of that space. Many of you have heard of Aaron Brockovich and others, but that's when it really came to like commercial prominence, when we heard about that in environmental health. And citizen scientists had a big place in environmental health, where people in their communities were collecting soil samples, right? Where parents used to collect paint samples from their house, take that paint sample down to the health department to look at the lead levels in the paint, looking at collecting water samples that look like lead levels in water and other things. And it started off from that place of people saying, hey, something's going on in my community. I'm not necessarily trained as a basic scientist or trained as a scientist this way, but I'm recognizing that there's things, conditions, and outcomes I see in my community that I don't see in other communities. And so I want to know more about that. And they became active and reclaimed the ownership of how knowledge is formulated in their community. So that's kind of where the citizen scientist piece originated. But then what we've tried to do with the model is engage African-American men, and particularly in helping us to develop research questions. And it's rooted in the principles of community-based participatory research, where research that is conducted based on the needs and priorities of the communities that we serve. But it's also a way for community members to have an equitable partnership in this work. And that term citizen, I know some communities say, well, there's some controversy over that term citizen, but it was very important, in working with Marcus and Project Brotherhood, to say that no, as African-American men, we want to reclaim the word citizen, because when you think about the history of African-Americans often having not always been included as citizens, to reclaim that word citizen and tack onto that scientist is an opportunity for reclaiming that space too. But I do acknowledge that there are some communities that say that term may not be as inclusive for them, but I'm turning over to Marcus.
And if I could just add a little something. First, let me say, Doc Glover, that was a beautiful bio. I need to thank my team. It made me sound like I actually did some stuff. It also comes from this. For like 20 years at Project Brotherhood, our priority was improving the health status of Black men. And health, it's everything, physical, mental, the same thing the council was talking about. We weren't concerned about publishing. That wasn't our biggest concern. Throughout the years, the academic community, the scientific community, and when I use general terms like that, I'm talking about 85%. There's always that 15% rule of people who understand. They didn't respect our work. We averaged 43 Black men to see the doctor every week. We had 5 Black medical providers and about 60 to 70 other men just coming to hang out or using different varieties of our services. So we had 100 men coming by Project Brotherhood every Thursday night for 4 hours for 46, 47 weeks a year. And when we would talk about it, and we did internal surveys, we did our own internal focus groups, we partnered with people like Kurt, because we understand the importance of Kurt. None of the academic world, none of our academic or scientific colleagues respected that community. There's always a separation between academic and community. And even when we discuss it, we separate ourselves. And I'm wearing 2 hats today. So I'm gonna be a health professional, but I'm really from Chicago, south side of Chicago, so the community. But we separate that, and that causes a confusion. Not only does it cause a confusion internally in how, when you're developing partnerships, how they look at it, it also causes confusion all the way down to the input that people from the community have, all the way down to the budget. People don't respect the community for some reason. So everything Dr. Watson said was correct. The other underlying thing was showing that these Black men are scientists in their community, whether it's social science or, some other type of science. They might not be trained in academia science, but that doesn't lessen their input or their acknowledgement or the social science that they learn from being in the community. They know what's best. So everything Dr. Watson was said was correct, but we wanted it to be more like an equal playing field from the input that they give, the FUBU approach of designing our own programs for us and by us, as well as the business side for understanding that these brothers, even though you might think a Kurt is just a barbershop, the influence and impact that he has as a community health hub can reach thousands of men based on his clients and who his clients can reach. We like to call that, you all call it some type of form of collective consciousness. We just like to say collective soul, each one teach one. So that's basically where it comes from and the concept for Black men.
Thank you so much, man. That is, I'm already I'm seeing the shout outs in the chat, the thumbs up, the loves, it's already, and you just started with the first question of what is citizen science. So I have a couple of questions. My mind is buzzing, but let me ask you this. Can you walk us through the project that you all did together and sort of how you came together from the research and the partnership with the community groups? And importantly, because you said a couple times that there's not often respect for the community partners. As you're walking us through the partnership and the project, talk about where respect showed up and what respect looks like. Because I think from the academic perspective, we may not always understand what respect looks like. And I think a lot of times we think respect looks like a gas card. And I'm guessing that is not what that looks like, but that's how or an honorarium. So tell us what your project was, what it looked like, and what respect looked like from each of your perspectives.
Okay, Corinne, you mind if I start with this one? So I would say first, for us, research is about relationships. You know what I'm saying? So if you don't have a relationship with your co-PIs or with your partners, your research is going to be a little bit harder to get. So about a little over 20 years ago, maybe 21 years ago, I can't remember, Kurt and I babies, they were real little. We had a brother at Project Brotherhood. We got an American Cancer Society grant to look at colorectal screening with Black men. So we didn't start the barbershop projects, but we definitely had a lot to, bringing it back to life. So we had a barber that was already actually in Project Brotherhood. So our philosophy with all our issues or education with Black men is meeting Black men where they are. So if it's the barbershop, if it's on the corner, if it's a sporting event, if it's a church, if it's in front of the liquor store, we like to go to where they are. So we came up with our idea to educate and partner with 5-6 barbers and put some Hemocoat cards in that shop and just try to get men aware, first of all, of educating them about colorectal cancer. And then, and this is the funny part for you academics. We didn't push for them to actually get screened with us, like per se to get screened back with Cook County Health and Hospital System. If they didn't want to use our card, cool, go see your own provider. A lot of times in grants, we say we give out education, but we always have to collect data for the numbers. We didn't do that. It was more about education. And if you wanted to get screened, we had the cards in the shop. You could do it. If not, go to your provider. If not, just listen. So that how we got to Kurt was, I'd always known about Kurt's shop because Kurt's shop's in my neighborhood in South Shore. I had never went to Kurt at the time just because, I had braids and, a wild beard in my mole. So one of my barbers went to high school with Kurt. I knew his name. He went to high school with him. And Chicago's small, even though it's big. And I'm sure Kurt checked us out. And then once we met, it was like a match made in heaven. We had the same goals, same principles. We still debate probably who has the better jump shot. I give it to him because he still plays and I don't. But that relationship that we got with Kurt, and I almost speak for him, he can speak for himself. And I think he saw that initial collaboration we did with these barbers, where we met with these barbers, some of our providers came in and we talked. And it started off about learning about colorectal cancer, and then it went into real life. And they became resources for us, and we became resources for them. And Kurt, do you want to add anything to about, just the beginning, how we met in that first project, and then we'll tie it back in with Corinne?
Yes. So back when we first met, it was just a new adventure. I wanted to help. Marcus needed the help, and I was all in. And once we met, it flowed like butter, melted butter. We came in, they said what they needed from us. And the biggest thing was our time. So we had to figure out what time barbers can help the most and still not miss money. So we figured out Sunday and Monday, most barbers are off. So we figured out Monday would be the best thing to do. So then, okay, that we had the time. So how can you not waste the time? So then they said they could teach us and show us how to do things, and they would actually give us some money for it. So then your eyes, you sit up in the chair, then you're like, okay, let's go, let's get started. So then they actually started to give us money for taking classes, learning different things about colorectal cancer, lung cancer. And then they actually added something too. They fed us as well. And we took the class. They had screens and projectors showing us. They gave us pamphlets and everything to educate us the right way so we could educate our customers the right way. So the biggest thing that we need to get across to our customers is that we wanted to start changing the mindset of how Black men view their health and not going to the doctor when something is hurting real bad, when something's falling out, when it's too late, when all of a sudden you go to the doctor and you get bad news, bad news, bad news. So if we change the mindset of going to screen for this, that, and the other different illnesses, then a lot of this stuff is preventable. So that was the start. And the relationships that I have with my customers is real personable. I find out their wives, their girlfriends, their kids, what they're doing, vacations. We are really close. They trust us, first of all, to be that close and in their space. Second of all, to make somebody look good, you hope they feel good, then they act good. So that's my motto. So we definitely dive into personal lives, and you remember a lot of what your customer says, but the time they were there before. So if they went on vacation, Vegas, California, you ask them about that, and then they understand that you're building a relationship and you're trying to get and dive into their lives. So then they start to trust you more and more each time. And I've learned how to do that as, a young barber. I've been cutting hair since I was 17 in high school. So I still have customers from high school. So just understand how a relationship is built for that long a time. You're not just a barber, you're their friend, you're a hangout buddy, you're this, you're that, you play ball, you talk about any and everything. So to introduce different illnesses and different things to make them healthier or to help them better their lives was easy. So you introduce screening in a way, it's just a regular conversation. So they was apt to listen because I literally cut 2 or 3 generations for a lot of different individuals. So when you are cutting the dad, the granddad, and the kids, imagine how many lives that we can save. So then that's what it's all about. We are in it to help not just one, but not just a community in the United States, the city of Chicago, the state of Illinois, but all over. I'm not in it to just save one person. I don't get any satisfaction by somebody telling me I helped one. I want to help thousands, hundreds, millions. I want to help everybody. So if you get into that mindset, just imagine how many people we can help. It's a great thing. It's a great cause, and we are in it to win it. You can use us any kind of way.
Doc Watson, let me ask something about Kurt before you jump in. So one thing that's crucial to add, because the question was, how did that relationship begin? Now Kurt's being humble, and I've already talked about the access to many has, but it being humble, the influence that he has as a Black man, and then being a barber on his clients is powerful. You can't just grab, it's not that thing, if you build it, they will come. You can't just go to any barber shop. And like he said, I don't know if you all caught it, his heart was in it first. And at Project Brotherhood, when we go after partners, I'll tell a little trade secret. We never start with money. 99% of the people say, hey, I want to participate. I want to help regardless. And then I said, oh, by the way, we got this money. And we try to give them as much money as possible. Whatever we could do, because we understand without these brothers, none of the work is getting done. And that's the community aspect. Those are really the scientists that are able to do the engagement, that are able to recruit, that are able to disseminate whatever we create together, as opposed to the other way around. So Dr. Watson is a different story. I like the version that he tells on how we met, and then we'll bring it back together with all three of us.
So as Marcus said, relationship is so important. I was new to Chicago. I'm from Michigan originally, but Chicago embraced me, and I'll talk about that later, because for Chicago to embrace me, that took some work. Because when you work on I live and work on the south side of Chicago, and to be embraced, it's almost like there has to be the city has this inner knowledge of knowing authenticity, and they know when you're real, and they know when what you want to do is of service. And we, as a people, even, we have that spiritual and that innate intuition to know someone's true intentions. But I heard about Project Brotherhood. I was a graduate student in public health, trying to engage African American men. It was important for me to engage African American men because I had some health histories in my family, where dad had colorectal cancer, brother had kidney transplant, and other things going on. So I wanted to engage Black men. So when I found out about Project Brotherhood, this clinic on the south side of Chicago engaging Black men, dispelling that myth that Black men, that this FUBU concept of health didn't exist, I was all over it. So I walked into Project Brotherhood, and I was doing some faith-based work. And when you're a graduate student, you know some people, you met some people. I walked in Project Brotherhood, dropped a couple names. Oh, I know this person, I know that person. And Marcus was looking at me like, "And we don't care who you know." And they was like, "Well, and they was like, "We doing a focus group in the back. We got some focus group back. You can take a look around." And I literally did a tour. It was a Thursday afternoon. I'll never forget it, because their clinic was on Thursdays. And I look around, and you see all these Black men serving other Black men. And then I saw like a room with at the time they had this advertisement board that had all these advertisements for jobs. And then it was like, if you need help with your resume, stop in on Thursday. They had a rites of passage development program that they were doing. And I was like, what is this? I felt like this was before Wakanda. I felt like I had walked into our own little Wakanda for Black men, by Black men. And I was like, do people know about this? And I was like, are people supposed to know? Because it was just that magical and amazing. But it wasn't the names that I dropped that allowed Marcus and others to take me in. It was the fact that I was a young, inquisitive student, and they actually forgave me for dropping the names, because dropping the names was not what was going to get me in. What was going to get me in was understanding that I was humble and I wanted to learn. And that's where the turnaround relationship happened. And I told Marcus I needed some help doing some outreach work at a large African-American church on the South Side. He was like, "All right, I can get some people for you. We got a nutrition program. We got this, we got that." And that started the relationship, and ultimately the friendship. But I also want to go back to a conference, and when I was a graduate student, to tell you the power of community, it wasn't the academic partners that sent me to my first APHA meeting. It was actually Project Brotherhood. Project Brotherhood did scholarships back in the day, and they still do, to get young African-American public health graduate students and even public health professionals exposed to public health. Project Brotherhood helped me go to APHA conference, and we were at a meeting, and I heard you kept hearing Black men as that hard to reach population. And so Marcus was like, I'm kind of tired of that narrative, because all the projects I've been engaging in African-American men, they've never been hard to reach for me. Folks just aren't coming where we are. So Marcus, we started brainstorming about this, and Marcus actually brought the concept of citizen scientists to me and was like, I want to rethink this concept of citizen scientists to reclaim our work and our space in this. So that led to a conversation. And as the academic partner, I went and said, what will my academic peers, what will make them hear this in that way? And what will make this evidence-based? So University of Florida actually had a citizen scientist curriculum that was online. We sent them an email, asked them if we could utilize it. And then we set out to adapt that citizen scientist curriculum that the University of Florida had, put it through all the appropriate procedures with the IRB and everything, and finally got that approved. But even the adaptation of that citizen science curriculum was done by a young Black male graduate student who's now working on his PhD at Tulane University School of Public Health. So, and I'll end with this too before we go on. Even when we were thinking about how would we compensate the citizen scientists that we would put through this 6-week training program, Marcus was very clear. He's like, Kareem, I know the health system has utilized consultants. I want you to understand that these citizen scientists, you're not training them. And Marcus said, you train animals, you're engaging them. You consider these citizen scientists your consultants. And although you all will be engaging them in this concept, in this curriculum, they are the experts in certain areas. Yes, you're going to teach them about age-appropriate, risk-appropriate cancer screening, but they're bringing to you a whole nother level of skill set. So we actually compensated them on every Saturday that they attended at the same rate that that I would be compensated as an academic partner if I did an NIH training. And we had to get that through the IRB to say, this is not a coercive amount. This is actually an amount that's actually acknowledging the community and wisdom and lived experience that these experts are bringing to this work. And as a result of that expertise, I never had a study engaging African-American men that didn't meet or exceed enrollment. And all that happened because of the institutional and community knowledge that Marcus and team brought to this work.
I mean, you also need the academic partner that's willing to fight for the brothers too, though. Because, just because I could say Dr. Watson fights for us, because there's a lot of academic people that don't understand the fight. And if they're not, because usually we're not sitting in those meetings. That's another thing as well from the relationship. Dr. Watson invites me in those meetings. Even if I don't want to come, if I don't want to listen, I'm still invited to sit there to be an advocate for myself, Kurt, and just the brothers we know.
This so again, you're getting shout outs. This is amazing. I love the comment about the language. You said two things about just how we position and how we language things, and I think that is so that these are so important. I want to take one step back. So Kareem walks in, he's like, I know X, Y, and Z. Marcus is like, I don't care who you know, because Marcus is like that. I don't know who you know, but that doesn't matter to me. Who are you? Marcus, at what point did you decide that Kareem was ready and right, like ready to go? Like, how did you, because he came in with all his academic splendor.
Well, he didn't say he was a student when he came in. If he did, I mean, I could tell he was a student. Actually, the name he dropped, he's cool with both of us, but at that time I was pissed off with the cat. He's being nice. I told that name might get you kicked out of here, Jack. But I said, make sure you tell him I said it. But besides that, Chicago's small. So we have mutual, how can I be respectful to the people older than us? I don't want to call them elders. We have mutual, mature peers, regardless of race, and names drop. Oh, this brother's cool, this person's cool, this person's cool. And then I can't remember the project, but we sat in a meeting together. I think there was 3 to 4 universities. Kareem was representing UIC, there was Northwestern, University of Chicago. And it was a joint project to work with a community partner. And his energy and confidence at the time was different from people, he says he's up, from young people his age to me. Like he wasn't scared to voice his opinion for Black men on what was right. He was a fair dude, what was right. And I saw the way the other people, and I think there was only one other Black person in the room. And not that race makes a difference, but it does make a difference with Black men. I saw how he was perceived. I saw how they listened to him. He didn't come across as the angry Black man, but besides that, we talked, we built a relationship, and he cared about Black men. That's really all it takes. So for everybody, if you come in with open arms, we're gonna welcome you with open arms. Now, if you turn out to be a fraud, hey, I just got to deal with it. And I met a lot of them. But Kareem has always been righteous, and I'm not gonna sit here and say the next day we kicked the kumbaya and started writing grants. He was in school, I was doing my thing. And then over the years, for the past 10 years, has it been 10? I said we worked on a lot of projects. Kareem has helped me go back to school, finish my undergrad and my master's, helping me get into a doctoral program. He's helped me professionally in ways that and even though he's younger, in ways that other Black academic men have not reached out. I mean, hell, because of Kareem, somebody just told me this, Kareem, I've published like 13 times, and I know 7 or 8 of them have to be with Dr. Watson. So,
Right.
so that relationship, it's, excuse my language, it's not bullshit. If Kurt calls Kareem, when Dr. Watson used to run a couple of federally qualified health centers, one is basically adjacent to Kurt's barbershop. Kareem will walk over there. You don't have what was your type, chief executive officer? The big shot. You don't have the number 1 or number 2 guy coming over to a barbershop talking to him. You know what I'm saying? If we needed patients to be seen, Kareem would be an advocate. So when you see brothers, and this is regardless of race, because I have some comrades that aren't Black, but regardless of race, when you see brothers that actually care and want to look out for another brother, I think that type of bond, like with Kurt, it builds it quicker. So that trust is there quicker. And the last thing I will say this, Dr. Watson has always told me, he said, Joe, I work for academia, I work for this. If you catch me slipping, hold me accountable.
Mm-hmm.
And who else is gonna say that? Hold me accountable. I said, okay, I will, but you really don't slip up. So,
And there was acknowledgement that I worked in a system, right? I think of the Audre Lorde quote that, the master's not going to give you the tools to destroy, the whole system that has actually have built the whole system that they've benefited from. And I think about that. And so I tell my community partners and to be accountability partners with me, I'm like, because I work within a system and it's real easy for you to get too aligned with the system, because there's a certain way that you have to get things through the system that are not, in most cases, the ways you get things through the system and align with the system they exclude community from being an equitable partner with you. Even the way we have to compensate community and the multiple loops that they have to jump through just to get compensated for the equitable work that they do with us, it's a system barrier and it's an inequity. But I think about, there was a question in the chat, and Dr. Wick Glover, I'm trying to look at the questions. Someone asked, how did the pandemic impact the relationship? Right before the pandemic, Kurt and I and Marcus, we were getting ready to do this big colorectal cancer screening project where it was going to involve dropping off fit cards and everything. But then the pandemic happened. And so we had to pivot. I couldn't say to Kurt, oh, Kurt, I'm sorry, I'm only funded to do this colorectal cancer screening. We actually went back to the funder, and shout out to the funder at the time, which was a foundation. And we went back to that funder and said, can we pivot some of the work that we were doing on educating around colorectal cancer screening? Can we pivot to educating about COVID-19? And because of Kurt got introduced Marcus, and Kurt introduced us to another stylist who was off. And these are also business owners. I also want to shout out the fact that these are business owners and respected members of the community. So Kurt got together another stylist for us, and we did a town hall forum with barbers and how they could open up their clinic in a safe and effective way. And when Kurt called us, we dropped off masks and hand sanitizer and everything else that Kurt needed to open up his shop in a safe way. And Kurt, correct me if I'm wrong, but because of the practices that you took, you never got any reports of any of your clients that were affected by COVID-19 through your shop.
That's correct. We did everything that Kareem advised us to do to the T. And to my knowledge, nobody received COVID here or brought it in and transferred it. We did a very, very thorough job. We sprayed everything. We kept everything clean. I can say it now because there's nothing they can do about it. But we never closed. We really never closed. We tried to do everything and accommodate everybody as best as possible. And we did, and it was successful. And I guess we'll do it again if we have to. Thanks a lot, Kareem, again.
and so you all, I don't know if you all caught that dynamic that how we just transitioned to the relationship. So from Dr. Watson meeting Kurt, of course, Kurt and I had our conversations, whatever brothers talk about. Is he cool? Is he all right? Is he solid? And I said, yeah. And Kurt has to vet him himself, though. Just because I gave him a pass, Kurt vetted him himself. They're on projects together without Project Brotherhood, which is fine with Project Brotherhood. Because when we have relationships with people, we don't mind the knowledge being told. You know what I'm saying? We don't mind sharing information. It's not a thing where I'm gonna say, oh, you didn't have us on this project. So I'm happy to see that relationship foster and turn into a good one and the projects that they're doing. But that's that relationship. So when Dr. Watson said, because when COVID came, we couldn't interact. But Dr. Watson said, no, we still gonna figure out a way to pay this brother and utilize this brother's skills, as opposed to saying, oh, project's over, let's move on to the next one. So basically what I'm trying to say in researchers' terms, Dr. Watson, and sometimes we call him Kareem out of habit, but I like to call him Dr. Watson professionally when we're on Zooms. But so if I call him Kareem, it's that relationship. He cares about us and he doesn't do helicopter research. He still comes around if the project's over. He'll still go out his way to talk to you. So when people ask, what can I do to build a relationship? You treat it like anything else. You know, you're not, if you meet somebody and you want to do business with them and you want to do real business, and then I feel this giving back, get to know the individual, have lunch. I don't know, go to a baseball game. Like some of the things that we've done in this project is the ability to listen. So here's another funny story. Now Kurt and I have never actually played basketball against each other. And like I said, I give him his credit because he's in shape now. But I'm telling you, Kurt, I was cold. So when we had a project once, I came to Dr. Watson. I said, hey, let's do something unique. Let's throw a 3-on-3 basketball tournament. And he listened. And he said, let me see how I'm going to swing this to the academics, to the higher ups. Did it. And of course, my guy Kurt won the tournament. But even things like that, doing something unique and innovative that's going to bring Black men out, as opposed to just, have us sitting there, have us just talking about, prostate cancer or colorectal cancer and nothing else. So when Kurt was talking about food earlier, just to go back to that does something special to me. Dr. Washington tell you, and this is one of the things that happened in our relationship. Project Brotherhood is always known for throwing what we like to call a ghetto soiree. We'll have fried chicken, we'll have jerk chicken, and then we'll have some salads and all that. We'll have pop. We have what brothers want to eat. So when I got with Dr. Watts, he was like, yo, man, we can't be feeding them all this fried food all the time. I'm going to swing about my people. So gradually, I had to compromise, and he compromised. We started eating healthy, and then he saw, hey, man, forget that. Let's get this jerk chicken for these brothers. And because food is just something special. We all remember that movie Soul Food. So if you gathering with brothers and you feeding them good, let's do it. And then put it this way: if all them deans and provosts can have fancy dinners, then hell, we can too. But that's part of that relationship building and even compromise. So the main thing I would say with all three of us is the CUC: communication, understanding, and compromise.
I'm in the meeting.
And even the fact right now that Kurt is multitasking, that's very important for people to be able to recognize and honor that, because we infringed upon his time. It's a Thursday afternoon for a barber. That's a busy time for them. And so he's taking out his time out of his business and multitasking to be in that space. But even that is a part of the work. The first time we did the Citizen Scientist Project, Marcus, I don't know if you remember, Marcus, you kind of let me fail a little bit. And that's the other thing, Marcus, he'll give you that space, a safe space to fail, because he was like, you sure we got to do it on Saturdays? And I was like, yeah, we got to do it on Saturdays, Marcus, because A, B, and C. He knew that the barbers that we had recruited, we had 3 for the first Citizen Scientist curriculum. But in my head, I said, well, Marcus, how much will they make per cut? And he was like, all right, you can find that out. And so I found out what the cost would be they would make per cut. And I said, we're going to have them there from 8, from like 9 to 12. That means they would have probably got like 4 cuts in, so we can compensate them this. So that'd be that. And he was like, all right, you did your math. Okay, you got your little formula. And then the barbers that we had recruited, we had 3 originally, Marcus. I don't know if you remember, 2 of them dropped off. They was like, dude, I still can't be away from my shop, even though you're going to compensate me. I own the shop. And so I got to be there to make sure that I see what's going on. And some of my community members, when they come, they don't see me there. They get concerned, even though I'm not cutting them for that day. And so the next time, and so we had the two of the barbers drop off, we only had one. So the next time we did it, guess when we did the training? We did it on Mondays from 4 p.m. to 7 p.m. because that was the time that Marcus had originally recommended to us. But we had to make that space. The other example Marcus did was we recruited for the prostate cancer study for the first time. We went to this faith-based organization without letting the citizen scientists really inform how we would recruit there. We went there and it wasn't an epic fail, but it was close to an epic fail. We had like 2 men enrolled. Next time, Marcus was like, all right, you're gonna involve the citizen scientists in planning this for real. We had to turn men away. It was so, I mean, it was like night and day and Marcus was like, that's your pre and post data right there. When you didn't use the citizen scientists, you got 2 people enrolled. When you use the citizen scientists in an effective way, you more than tripled your enrollment. And so as an academic partner, I often say, I learned more from the community than I did from professors. And I'll turn over to Kurt after this one. I was taking a class in qualitative research, right? And so we had all the ethnographic training and, learn how to use, deduce and all these programs, but it was sitting in a focus group that Marcus was doing on an oral cancer screening project at the time, where I was able to look around the room and have real world experience about what it meant. So I found, okay, so this is how you actually take notes in a qualitative interview. This is how you ask a question. This is how you to do that. I learned that by sitting in a focus group at Project Brotherhood that I wasn't even a part of. I was invited by Marcus to observe. So it's also important for us to understand the teaching opportunities that our community members can provide, and for us to even think about how do we compensate community members being community faculties in School of Public Health.
Let me jump in real quick. This is amazing conversation. We have some questions coming in and I want to make sure that we get to them. So I know you answered one of the questions, but can you talk about when you were developing your research questions with your community partners, what does that look like? And I know you provided an answer, but if you could just talk a little bit about what does that process look like? You're developing a research question with your community partner, the process and timeline. And then can you also just give us a little bit of a snippet of, somebody asked an example of when a partnership has failed, academics and partners did not succeed, and how and why that happened. And that story that you just told about, we didn't listen to Marcus, we got 2 people, we listened to Marcus and we had to turn people away. What happened? What did you do differently? So first question, tell us about the research process, how you engaged with community members to come up with the research questions together. And second, spill the tea on what happened when you didn't listen to Marcus. What did you do? And then what did you do when you listened to Marcus?
I'll give 2 examples. When I listened to Marcus, we didn't have to do an amendment or anything because it was already written that way. But it was just that the way it was trying to put the way that the community was working into a protocol. It's not always a way to put that into a protocol. It wasn't a way that you can make it a systemized methodological process, for example. We just simply had to say, how do you listen to this? And Marcus was like, just observe the way that Dr. Ben-Levy interact with these people. If you observe Dr. Ben-Levy's interactions, you'll see who the go-to person is. If you observe this interaction, you'll see who the go-to person is for that. And that's what we did differently, Dr. Wicklove, was just simply listen. It was simply listening and saying that, all right, this is not going to look like something that I can maybe publish as a sequential, longitudinal way of how we got this idea, how we did that. We simply humbled ourselves and listened and treated the community partner as, even that word community partner, I know Marcus and I struggle with it because if we're not careful, it almost is a hierarchy in calling your community partner a community partner, because it's in just in language in and of itself, there's a hierarchy in academic versus community, right? So we've struggled with even saying, do we call them stakeholders? What do we, even the language is systematized and colonized and doesn't really give us the space to really elevate the community partner or stakeholder to what that relationship is. But I did have one project where community members wanted to, mid-project, they had a different priority of what they wanted the project to be about. I went to the funder and said, oh, we were developing a toolkit. I went to the funder and was like, hey, I do CBPR. The community has told me that they want to prioritize this. And the funder was like, well, no, that's not what we funded you for. We funded you to do this. I said, but you knew I did CBPR when you funded me. So I had to make a decision. Was I willing to risk not being funded by that organization again? Or was I willing to risk that community partner not ever working with me again? I chose the community partner. And that was a big risk. I said that, and I went to the community partner and I said, all right, they probably not gonna fund me again. So if you want to work with them again, you're gonna have to apply yourself, because this didn't end the way we're gonna do what you need and what you said. And that community partner ended up advocating for me in ways that even the funder couldn't advocate for me. And so that was an amazing lesson learned, but it did come at having a real honest, open conversation with that community partner and saying, I'm going to do what's the priority to you all, but this does look a little different. And it wasn't anything unethical. It was just that they had prioritized something different as cancer survivors than what we originally thought the project was going to be about. And so we had to pivot and make that pivot, and you got to make a choice. And if one recommendation I would say is always bet on your community, because at the end of the day, that's the sustainability partner. Yes, you have to be responsible to this funder and do the right thing, ethically and fiscally responsible. But when you align your priorities to serving your community, I think I know you will always win. It may not look like it in the beginning. It may look like you walking away from an opportunity, but you'll always win in the end.
And just to answer your first question, let me say this too. Dr. Watson already knows this. So he's a part of that 15% of academia. You know what I'm saying? So the stuff he might say he picked up, those are just little things, like he'll teach me how to write an IRB or something, or how to complete that. So in terms of brothers like Curtin and just brothers that we messed with the citizen scientists, not only are we, before I answer the question about the research question, we try to get these brothers to a level where even if they don't mess with us, they'll be valuable to any academic partner. Like Kurt understands the IRB. You know, he got that, what is that called? That CITI train.
Exactly.
You know,
All citizen scientists went through CITI training if they wanted it.
Right. So they understand it to make him more valuable with his academic partners. But the thing is, we don't want to waste citizen scientists' time. So we come with a baseline approach and say, hey, how does this sound? How does this act? So let me give you a hardcore example. If we're talking to Kurt about, we want him to talk to people in the shop about colorectal cancer, we got the fit cards there, he's going to tell us how it goes. He's going to tell us, I might not want to bother them at, right when they get in the cut. I might have to see how they feel for a little while. It might not be the first visit. So if it's not the first visit, like if he's come, and he didn't state it specifically, but if somebody's coming in with something on their mind, they definitely don't want to hear no health information. So he said, so I'm gonna need signage. I'm gonna need some other things in the shop that might, jog their memory or trigger them, or they see it there. So that means that we have to go back to Kareem, and now Kareem has to fill out some more IB stuff, or whatever academic partner, to leave some printed materials as well. So even designing how we interact with Black men in his shop is very, very important, because it especially if you really want to think about it, there's not a lot of Black men in healthcare. So a lot of these grants and research are done by women. And if you've never been in a barber shop to understand the process and how it goes and how to engage men, just because something worked in Dallas, Texas, or someplace in some small group doesn't mean it's going to work in South Shore, on the south side of Chicago, or in Inglewood. So their input in designing stuff is very important. If I could give you another example, and this wasn't necessarily with Kurt, it was with another barber, and it kind of slipped by me. Once we started doing surveys, we just, we use the same language. We had on there, have you ever been incarcerated? What does that mean? We use that often. Have you ever been in county jail? Have you ever been on probation? Have you ever been to prison? So that brother at the time caught that and reminded me, like, oh yeah, you're right. We have to break it down even to certain levels. So somebody like Kurt, people will come to, we can just use me and Kareem. You have Kareem that comes there, shop. You have myself. You have some CEOs. You know, I've been in the shop. Kurt will look out for some brothers who, you know, are homeless and down and out. So he has an understanding of different type of men and how to engage them and how to approach them in the best way. So that's very important. And the last thing before we get to another example. So this is, every time I tell a story, it's not about Dr. Watson. I just want to throw that out there. But one time, this isn't about him, but he was on this project with me. We were on a project, and I forgot what project, and we were trying to do something for Black men. So the other brother on the project, I think he was the lead PI, he was like, no, let's do it on this Sunday. And we had a fancy place, and you know, we had the right food, and I was like, we shouldn't do it on a Sunday, man. And he was like, no, we're gonna do it on a Sunday. Now, what the brother didn't know was Sunday, this when Derrick Rose was still on the Bulls, he was playing LeBron in like a game 5 or 6. And so like, I said, all right, let's do it on a Sunday then, you know. Came down, nobody showed up. Why? Because the game was on. So Dr. Watson learned from situations, even though it wasn't him, he had nothing to do with it, learned from situations like that and said, it makes sense. You know, how you gonna have an event for Black men in Chicago and we're in the playoffs playing LeBron on the game 5? Like, who's gonna come to that? You know, so those are the things that I think Kurt, myself, and brothers who are not strictly academics help Dr. Watson, whether he understands it, and then he becomes an advocate for us. But if we don't have more Dr. Watsons, like once he leaves a project or goes somewhere, you know, that shit could go south real quick.
So this is, so what I'm hearing is this theme. So I've heard a theme of relationship and being authentic in relationship, but I'm also hearing this theme of flexibility and researchers being, academics being willing to stand up for what the community's priorities are and being able to be flexible with approaches. And I think sometimes as we, you know, when we have a protocol and we submit it, we're often taught you stick with the protocol. And so you are also making it clear. So implementation science, certainly we can be flexible, but you're making it clear that as much as we say that things need to be rigid, we can be flexible, and there are some opportunities. There is a question in the chat that I want to ask about it related to that is, are there any other lessons learned or strategies when working with funders you recommend for advocating for more resources to advance equitable community partner inclusion in the work? And I feel like that's tied to flexibility. And then any grant making changes you've advocated for, like multi-year general operating support to help shift power to lead or community organization. I'm not sure about that last part, but in thinking about flexibility in terms of protocol, Kareem, you said flexibility in terms of, you said, hey, I advocated, they might not fund me anymore. The community is going to have to be the one that gets funded now. Talk a little bit about that in the answer to that question.
Yeah, in brief, and I have to give a shout out to Dr. Haley Thompson in Detroit, Michigan at Wayne State School of Medicine at Carmanos. This is a lesson that Haley taught me, Dr. Thompson taught me. She had a PCORI funded project, and she knew about sustainability. And one thing that she said is that she knew the project would be successful, not if she got refunded, but if the community got funded to do the same thing she was doing. So that became one of my benchmarks. It's not just enough for me to be funded, but it's enough. It's also how do you introduce the community to ways to be funded? So we had to start having capacity building conversations. And Marcus and I, you know, sometimes Marcus was like, nah, Kareem, I don't want to do that. I don't want to publish. I'm good. People know me. And I was like, Marcus, yeah, but when this grant goes in front of this grant review committee, they're not going to care the model I used, or they're actually going to care, and it's not going to be given the rigor that it has if we don't have a publication on it. So we had to publish the Murray model to introduce it as an evidence-based theoretical and behavioral model for engaging African-American men. The Murray model, I encourage you all to go out there and look at it. It's a publication on it and use it. Use the Murray model, publish it in your work, write it into your grants. But, we have to think about capacity building. So one of the things that you have to do as the academic partner is find out ways you can engage the community before the research project starts. Because once the research project starts, that funding award starts, you got to hit the road running. So start thinking about what are those barriers that prevent community partners from getting engaged. So I start telling community partners early, hey, you got an NIH bio sketch? No, you don't. All right, we need to get you one. It's similar to a resume, but it's the resume that we use in the grant making space. Hey, if you're going to be a part of the research team, think about what ways you want to be engaged. Do you know how to develop an equitable budget? Has your community-based organization reviewed your indirect rates? Is the 10% appropriate for you, or should you be getting a higher indirect rate? And have you went back and renegotiated what that indirect rate is? Do you even know what an indirect rate is, right? Having conversation with community partners about all that stuff on the front end in terms of the capacity building space. And then finding the right grant mechanism that's right for you. As a community-based organization, you might not want to get into the federally funded NIH world of research because that might not be the space for you, but a Robert Wood Johnson grant, a PCORI grant, some other foundational grant may be the way you want to go. And academic partners have to be willing to invest in that time. And I've been trying to answer the question, Dr. Wick-Glover, in the Q&A, and hopefully we're answering those. But someone said, how do you balance the burden that you can put on community? I tell my colleagues all the time, when they ask community members to go to a meeting, and Marcus and Kurt had to tell me to stop doing this so much, because I'll be like, they asked y'all to come to this meeting, Marcus, but I told them y'all might not come, because Marcus was like, whoa, Kareem, we got to get paid, but it's okay for them to invite us, and then we can discuss that, because I was so adamant about the fact that I would always say, when I go to a meeting, it's on my work time usually, and I get paid for that. It's part of my delivery, it's part of my job. I'm very very blessed to have a privileged job where when I get paid for meetings, right? And so the community should get paid for meetings. So one of the ways that they completed the CITI training was completed that through time that they were compensated for.
I just want to pause to make sure Marcus and Kurt weren't gonna chime in. I have another question, and our time is dwindling rapidly and the questions are coming in faster than we can answer. And so I'm going to switch gears real quick. One question that we had was around how do you translate this citizen science model to things on a national scale? And so, Dr. Watson, I wonder if you could talk really quickly, like a 30-second snippet of what All of Us is, and then maybe use that as an example of if somebody was working at a national scale, how could they incorporate this citizen science model?
Thank you for that. So All of Us was one of the first organizations in the NIH, the National Institute of Health, to actually have a role like mine called the Chief Engagement Officer. And even before so our program is a part of the Precision Medicine Initiative that sets out to engage 1 million or more people in precision medicine, to collect data from people that can be used in research that connects this intersectionality of biological data, genomic data, as well as survey and social terms of health. So typically genomic studies that have enrolled populations have been over 85 to 90% white and or European. So that data, that research that comes from that data is not generalizable to the larger population. All of us set out to create one of the largest and most diverse data sets. And to date, we've actually done that. We have over 46% of our participants are diverse in terms of race and ethnicity. That happened through intentionality of site selection, make sure that where we do our recruitment and our enrollment is at and with communities that are diverse in and of themselves, including federally qualified health centers. And before we enrolled our first participant, we actually created a community engagement ecosystem to fund over 14 national, at the time fund 4 national community engagement partnerships that have now reached to over 115 community partners. So we have and if I look tired, it's because I just got back from a 2-day workshop where we were engaging our community partners in a face-to-face conference in Bethesda, Maryland, engaging them as partners in this work. And so I knew the program was serious. And before I worked for the NIH, they caught my attention when they funded DREF. DREF is the Delta Research Education Foundation, the not-for-profit arm of Delta Sigma Theta sorority. And I said, wait a second, DREF just got funded as an NIH awardee to be a community engagement partner. I said, all right, they might be actually serious about doing this work. Then they funded National Baptist Convention USA. as a community partner. And I was like, okay, so it's a faith-based engagement. Then we funded the American Association of Health and Disability to engage populations living with disability, National Alliance for Hispanic Health, the Asian Health Coalition, PrideNet for LGBTQ plus populations, 50 Forward for populations living in rural population greater than 65. So the theme I hope you hear is that we funded partners that reflect those communities that have been historically underrepresented in research. It's not rocket science, but it still is intentional and innovative.
That is awesome. Thank you for that. A couple.
Can I add
Yeah.
one thing?
Yeah.
Again, because of people like Dr. Watson going there and making these changes, just from for the sake of this conversation, from the community partner perspective, not to, I guess this was my cousin Murray that asked the question. Sometimes small, I hate to use words like this for me, small not-for-profits like Project Brotherhood, you ask what changes we might want to see to the grant making world. There's not really much we could do in terms of that, because when you're small, you have to have matching budgets and blah, 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 things of that nature. It's more of working with the PIs and having them understand how to create a budget, or being transparent with their budget and sharing it with the community partner, because there's plenty of times academics, and it's nobody's fault, just what they have in their budget in terms of what the priorities are in terms to do the project are usually off. Like if you just think from the community aspect, my first priority is going to be to transfer it to my key stakeholders, brothers like Kurt and other brothers who I know help and are very vital to the program. And then even things like adding more staff to the project. Usually when I work with academics, the academic team always gets a project coordinator, 3-4 other staff positions, but they expect the community organization just to do the work. If you get 3-4 staff members, we should get 2-3-4 staff members. So just things of that nature. And when you think about people like what's the difference in an American Cancer Society and a Project Brotherhood besides the size? We're both 501c3s, but they don't get looked at as community partners. So I know it was a little off the subject, but I just want to add my 2 cents here when they asked the questions about grant making and things we could change. And I think we need more people that like Dr. Watson, who actually came up through the system. He just didn't graduate college and apply for a federal job. You know, he came up. He learned every aspect of what it's like to engage in people, from writing grants to being a coordinator to being an administrator to going out in the community, outreaching to his position now. So by him having all those jobs, doing all that, writing budgets, he was able to understand and be an advocate. But so to sum it up, we just need more transparency with our academic partners. If they were more transparent in the development of the grant and the budget, and not call a partner once the grant is accepted, things will work out a lot better.
Can I ask us a quick practical question? I'm sorry, Kareem, were you going to say something?
And just real quickly too, I want to say that we have to think about, I'm going to put on my old academic hat. As a faculty member, we have to, those of us that are in leadership positions or who get in leadership positions, have to rethink the system of promotion and tenure. Most of the stuff that I did in community engaged work didn't count towards promotion and tenure and me advancing in the ranks as a faculty. It allowed me to advance in the ranks as a community engaged researcher, but not necessarily as a faculty. But because I learned more about what the community needed in terms of capacity building when, shout out to community partner in Inglewood on the South Side, they invited me to review some nutrition grants for them that community partners. We had a grocery store on the South Side of Chicago that was providing some seed funds to community members. They invited me in as a reviewer of those grants. In reviewing those grants, I was like, oh, wow, we got a lot of capacity building work to do with community partners. And so that's what let me know this concept of capacity building. That's not anything I learned in the classroom. That's not anything that an academic partner taught me. That was me sitting at the table with community partners, actually reviewing grants with them, where I began to see what some of those needs are. It was Susan G. Coleman taught me the same thing, right? That was when I was a grant reviewer, where community members were writing, where I was able to see, oh, we speak 2 different languages, but we're asking the community that when it's time to write grants to now speak our language. And that's not fair to them to think that they can translate what we do into this grant application all of a sudden. It was really an interesting learning opportunity.
And imagine this. Imagine if a university academic center, or for the sake of this conversation, let's say University of Chicago Cancer Center, truly partnered with Kurt's shop, put them on a budget for a minimum of $75,000 a year. Imagine the research that they would get from his community health hub and the money they would, because it's all to the academics, not the individuals, to the university. It's about money, publication, and press. So imagine through his connections, as opposed to just coming to him when a grant comes out, hey, we're gonna put you on budget, you know, we're gonna subcontract with you, minimum $75,000, because the research you would get from him and his connections to hooking you up with other barbers, churches, key stakeholders and clients, beauty shops, it's a worthwhile investment. So we just need people to understand that it's not about a money grab. And actually, I shouldn't have said 75, it really should be 6 figures, but you know, that's down the line. But so I said minimum, but, and I'm serious, when you have, and even when you have people on your team and you show an interest to them, you will get more bang for your buck.
Can you all talk about the practical aspects? Because you mentioned things like making sure that people have bio sketches, budgets, and things like that, and that the academic partners need to help with that, or CITI training. But practically speaking, how did you make that happen? Like, Kareem, did you have a workshop? Did you sit down? Did you have staff? How do you make that happen? And then there's also just a follow-up to your comments about the national scale, like community members. I think from Dr. Dolores Hart, she says like her community would find it difficult to create an acceptable NIH biosketch. So then talk about how do you adapt that to different types of communities?
That's when you know, as an academic, my graduate students would look at me and they say, now, why am I helping this community member with a biosketch? That's really part of my graduate research experience. Yep, that's a part of your experience. Not yet, yep, that's a part of your work. Being a graduate student in my lab is to help this community member develop the NIH biosketch, because you're gonna learn more about what that community members need. And I agree with the researcher. It's not practical sometimes for us to expect the community member, but to even have my research team, I know one of my colleagues, Erica Martinez, is on, you know, she would take a resume, and when it came time for that grant, we didn't tell the community partners sometimes to develop the biosketch. Sometimes we did it for them. We would say, send us your resume. We will do the first draft of putting that resume into a bio sketch so you can see it, and then we would encourage them to use it in other spaces. But you're right, and I don't want to make it seem like, oh, just tell the community to do it and they can do it. Sometimes we have to do it for them, and not do it for them because they weren't capable, but it's just like, I'm not a coder. I would need someone to code certain, you know, R and Python languages for me. I would need someone to do that for me in collaboration. So it's the same thing that we speak of in that space. That you have to get the resources to do. And the CTI support actually came from, this was an example when the National Institute of Health Clinical and Translational and Science Awards, what we call CTSAs, and they worked really well together, right? In Chicago, we actually had a project that was developed by this researcher that allowed community members to get CITI training. A community at the time could request for you to come out and do an in-person training for CITI training, which is the acronym for you getting trained to be able to work on IRBs. And as long as you had about 10 or more people, that academic partners would come out for free and do that community training. And it was funded through the CTSA, the Clinical and Translational Science Award by the National Institute of Health at a network of academic partners in Chicago.
I just want to acknowledge in the chat.
And one more thing, Doc Watson, tell them about Kurt and the Wi-Fi, that project too.
Right. And so one of the things we would do, and Marcus, you know, dropped off a set of iPads to us one time because I was like, well, Marcus, people need, and he was like, dude, I wrote this into a grant several years ago. I knew I was waiting on y'all to figure out that the community all sometime needed iPads. Not that they didn't have internet, but they're shorty, or their kids might be using the iPads for something else. So if you need an iPad for this, you should give them one. So we wrote a grant, in the supplies section, we wrote in there to be able to get iPads as well as hotspots to make sure that we're not overutilizing the bandwidth that some of the community partners had. But then at the end of that grant, yes, they kept the iPads, but we took I think the hotspots had to be taken back because we weren't allowed. But then that impacted, Kurt's ability to sit on a panel with a large pharma company, right? That wanted to engage him. And I was like, wow, that just shows you the difference in capacity. When he was on the academic grant at the time, he had access to the Wi-Fi and to the iPad, but then when the grant ended, was only able just to keep the iPad. But just thinking through things like that made a difference. And we saw that during the pandemic, right? That everything was not equal. Everybody the same. In my own neighborhood, I can tell when the kids get out of school, because we're working from home now, because my internet bandwidth changes when kids get out of school and people are coming home. So imagine that being your daily existence. So those are even nuances that you have to write into your budgets.
So for the researchers or the funders out there, and Dr. Watson knows that she's in a different capacity now. Imagine if you wanted to create this partnership, and let's say you really don't have a budget for $75,000. I'm not negotiating for Kurt right now either. But imagine if you say, well, look, Kurt, I got an extra $3,000-4,000 in my budget. I'm gonna pay for cable and Wi-Fi out of your shop, and make sure you have an iPad people could use, and then some type of laptop that I only want you to use for these type of sessions. And you bought them a TV or something. Now when they're having these sessions, just like that brother's in the chat now his clients can hear information. Now they can see things. You talking about $4,000 or $5,000, to start building that relationship. Now you're paying for cable. Now you got two TVs in the shop. He has Wi-Fi, things like that, allowing his clients to utilize the university. What if there's some little kids that want to just play basketball in the gym, or there's some young ladies or boys that want to have access to summer jobs or summer STEM programs. Dr. Watson used to tell us about Czech scholars and other programs that he didn't have to, that we could share with our peers. Hey, if you know any high school students interested in this, those are the relationship building things. And I hate stereotyping, to make us catch from us community members, say, man, we mess with y'all. And that's another thing too. Everybody on this call is from the community. We got to stop letting our jobs dictate what we call ourselves. Because if you ain't at your job, and especially if you got skin like me, they're going to call you from the hood too. And they probably not going to know you a PhD doctor or MD doctor, regardless of the car you driving or the clothes you got on. So sometimes we have to forget and stop being brainwashed by the schools we go to and fighting for tenure. And if you are, share that with your partner, community partner. We'll help you get that tenure. We'll help you change the language. But Black men are the same fathers, brothers, cousins, friends, boyfriends, buddies that you grew up with. Treat us that way, and stop thinking everything that was put in this book when we got this academic training fits for us, because all this stuff was basically by white men dictating and white women dictating to Black folks how we should be treated. I just had to say that. And the last part that I'm gonna say before I get off my thing, Project Brotherhood is not anti the system. We understand about the health belief model. We understand social ecological model, social cognitive. We understand all that. Just because I don't use it in my talks doesn't mean I don't understand. Everything we do is adapted from that until they respect us and we start doing more of our own things. So I just wanted to throw that out there. But I do like everybody. I just like Black folks more, and especially Bears fans.
Marcus is one of my favorite people on earth. I have to just say that. So I have a question. I don't know, Kurt, if you are still able to hear us. I have a question specifically for you. I want to just shout out Idris Robinson, who is one of the attendees. He is a doctoral student at Drexel University. Remember that name. He's going to be amazing, doing some great work around health and Black men. He had a question earlier, and it ties into another question that people had around when you're messaging. So you talked about, Kurt, having men across generations. Have you seen any differences in when you're talking about health with younger men in the chair, like, 38, I think Idris said 38 or below? Have you seen any differences in how you communicate with men or what they're receptive to as it relates to the content? And then have you heard or seen any of the men who are participating, who are sharing what they're learning with their family and friends after they leave you?
No, that's a very good question. So first of all, with me communicating with the younger generation, I have to get into their cell phones and the social media stance, because I'm personally not a social media guy. But when I talk about social media with them, they light up, they get excited, and they use it as a teaching moment for me. So that brings us closer together. And I definitely I get into it with them, and they show me that's it. They ask me, am I crazy for not using it? They ask me how old am I? What's wrong with me? But I definitely have to get into the social media aspect of everything with my younger generation. And I get a lot of feedback from different clients about how I've helped them. And I've just put awareness in their head so they can try to tell a family member that's older or younger. I've gotten feedback from dozens of customers where the screening has helped them, and it has let them know that they need to do further visits to the doctor to help them, save their lives. And since me and Marcus have been working with each other for, it's at least been 20 years, since '03. So we have definitely made a lot of difference in a lot of lives to help them change the mindset, change them, they're thinking about their health and what they put in their body, and is what they're gonna get out of their body. It's working from top to bottom, from the grants to the meetings to the education. It works because they first of all trust me. So if you come more than once or twice, you like what you're getting. And then from there, you just build a relationship, and it helps us all to come together by helping some people. You start to like them, then all of a sudden you're starting to love them. And if you love somebody, you show them love. You can tell them this anytime, but they get it from what you show them on a regular basis. And normally, Black men get their haircuts every 2 weeks, so that's twice a month. So I'm gonna see them a lot during the year, and imagine over 5 years, over 10 years. And, and I've been at my location for 23 years. So the relationships and everything that I have built and learned about people's feelings and their jobs and their relationships. I'm literally a counselor up here. I deal with a lot of mental stuff too, but that's another conversation. I'm definitely a psychiatrist up here, and I'll tell you a couple of stories that I've dealt with just from good relationships. So I had a lady come in, and this happens often. She comes in and she has a lot of hair, a lot of long hair. It's past her shoulders. So she comes in and she's like, Kurt, I need it all cut off. I want it all cut off. And I'm like, why? What's wrong? And she tells me that her sister has cancer. So that happens a lot in my profession. People, she wanted to get her hair cut off so she looks like her sister. And she has 5 sisters. And she's on the phone with the sister that has the cancer. And with this new technology, I was like, well, FaceTime. So she FaceTimes her sister, and she literally is letting her sister know how connected they're gonna be and how we're gonna do this, because she didn't believe it. She was like, I'm gonna do it. I'm not gonna do it. So then she was like, and I was talking to her, I was like, now once I start, there ain't no going back. So she did it. She cut the hair. Her and her sister were in the shop. They were crying on FaceTime. And it was like a great moment for them and their family. We prayed and they trusted me to take care of that situation in a delicate way, in a delicate manner. And another story, this guy comes in. I know he was in his 30s. He has a 13-year-old daughter. And he was like, Kurt, I got to tell you something. My daughter tried to commit suicide. So, that blew me away. I had to put the clippers down. And I was like, this man that I've been cutting for years, he came and he entrusted me with that information. And that's just the type of relationships that I build here, the type of trust they have in me. You just don't tell things like that to anybody. And from top to bottom, the programs that we're running, the things and everything with projects that we're in, it's working. And I can tell you more stories if you have more time. But that's recently, that's within the last month. Hey, Kurt. And hey, boy, how you doing? And so I'll just get back to your original question. Me dealing and handling men in their 30s is working because they can trust me and they know I'm here. And when you can trust somebody and you know they're there, you're gonna continue to give them stuff. And I'm learning as much as they getting from me, I'm getting stuff from them. So it's helping.
Wow.
Now y'all gonna tell me my man ain't no scientist in what he does? Seeing a brother 20 to 30 times a year, engaging with him for 30, 40 minutes. Not us. And then people want to say, it's just a barbershop. We pay him 50 hours. Nah, man, scientists ain't even good enough. So that's why we want Black men to be known as citizen scientists. Because if he tells that woman who got her hair cut off to talk about mammograms, she's gonna listen. If he directs that young brother whose daughter was thinking about suicide, directs her someplace, he's gonna listen. That's priceless, man. So you can't just. It's deeper than a barber. It's deeper than that. I'm off my horse again.
You all have been. I wish we had more time. You all have been absolutely phenomenal, and you are getting much love and praise in the chat. I feel like I'm going to get choked up, but you all have been absolutely phenomenal. This conversation has been amazing. I encourage all of you who are doing research as academics or who are doing research as citizen scientists to please take these words to heart. What I hear from this is we need to make sure that we're all equipped to make a difference. We can all have an influence on improving health and Black lives wherever we are. And if we aren't doing this to make a difference and improve lives, then why are we doing it? And so on behalf of the Council on Black Health, I just want to thank Kurt, Marcus, and Kareem. You all are amazing. I don't know if you have any last words. We are over time, but please, if you have one last quick word, please go ahead. Otherwise, just thank you so much.
Just one real quickly, you talked about I've been trying to get my friends to get their colonoscopies and get screened for colon cancer. We did one citizen scientist training. Like I tell my story, pretty transparently. We did one citizen scientist training, Dr. Wickover, and one of the citizen scientists found out that the American Cancer Society changed the age to 45. He then gets on the phone during the training and tells his primary care doctor, you told me I got to wait 5 years to get my screening. I just found out for some Black doctors, I'm supposed to get it now. He then tells his primary care doctor, I'm out, and we're friends too. So I'm out at different events and they're like, yeah, so-and-so told me to get my colonoscopy. I'm like, I've been telling y'all to get colonoscopy since forever, but they listen to this citizen scientist over listening to me. And these are all men under 50. And so that's just one example of the power of community and citizen scientists doing this work. They've had to reach even further than I was able to reach. So that inspires me to think about just continue to do this work.
Well, thank you all so much. And there's a note in the chat. We will be posting this webinar on our website. We understand there were some folks that tried to get in and couldn't get in. You all are in high demand. And so we will post this on our website. We thank you all, and we look forward to continuing to work and partner with you. Again, on behalf of the Council on Black Health, thank you so much for your participation today. And we look forward to seeing you on our next webinar.
Thank you.
Take it easy.
Thank you. Fantastic. Great.